comes to health and no money. Boss, good morning.
Good morning.
Bibia Boko dear.
Boko.
See a case obi Acheampong one way.
The health financing consultant, and I chose me the MNU so account, which is monitoring and evaluation consultant so account. Now, maybe a director of operations, and I'm sorry, director of R&D.
Okay.
Or National Health Insurance Authority. Now, me training in health financing.
Okay.
Me Juma America,
okay.
Blue Cross and Blue Shield, and Aetna, the major health insurance companies. And I'm saying Juma pharmaceutical companies and I'm share health insurance side of their business.
Okay.
And that was the preparation. Yeah, Sana Meba NHI. We Baba Juma NHI for 9 years.
9 years.
Yeah, President before time in me Juma 2 years.
Okay.
And President Mills and Mahama times me Juma 7 years.
Oh, okay.
Yeah.
Oh, okay.
And so after that, and Qatar government. No, I'm so health insurance in
Qatar.
Yes.
Okay.
And I'm a family call. Timmy Coboam. Almost a year or more. Now I'm head of utilization management and all services, transplants and normal service BI here approval and BBR.
Yes.
Now a Bamini area, a team of clinicians. Many of my says, well, I say, I dare no bit to a can, I say to a canteen. And then I'm here, and me free honor, and WHO, they may call South Africa. South Africa has no more health insurance.
Like how WHO no me for
World Health Organization.
Okay.
And I also so because boa in the policy to experience from Ghana. We say Ghana na be crab show.
Okay.
The people from all over the world. About Ghana has and then also this is many invitations to call several countries.
Yes.
Vietnam, Philippines, Thailand, Chile, Holland, several places. And so the or Ghana.
Oh, okay.
And I'm Mrs.
Also, the Nyansan be one common, and also John so be the buy.
Yes. And the country's piece is about Chroma. A barber shade, it's my background, I don't know.
Oh, okay. The meaning is when it comes to health insurance, Nankasa dia, Namedia Chow, what being Wumpa.
Naminado.
Now, my Miss Alcopio more carta or not. Quite best no more fast. Was it encouraging?
Yes, it was.
Okay.
Because almost bibia. But here's a case also by health insurance. They could pay for anything. Nipa area which may try the but no person may health insurance.
Oh, okay.
Because they wanted to move their country towards universal health coverage. WHO area behind that, pushing all countries is a yama obia any access to healthcare. Whether I say a buying area and I say private insurance area. So as I say obia nipane yarea, as I said, it won't mean to be a division. Yeah. And I know any idea almost no more yet. Oh no, almost they are at the time when they were the richest country on the face of the earth. But yeah, per capita. They were. But now more health insurance.
And then you're not just no music and semi pa.
Yeah.
That boy, give us history of health financing.
Ghana has. Yes, after independence, now user fees behind me.
You can use service area there.
This is hospitalized TSA.
Yes.
So and yes, I didn't know by into the 60s or no. And I have a Ghana government a partner with to say charge for religious organizations. Sorry, hospitals also all over Catholic hospitals, Presbyterian hospitals, now they almost partner with government. They produce healthcare. And Chibia and I introduce user fee because in the 70s, no, me made the Miko hospital, and I said, "Chia me many fee and me Miko na you're sharing free, but a draw they now be kakra." So, and you free one into the 80s, and a cash and carry by.
Okay.
The cash and carry by, Neding, Ye.
The cash and carry idea.
Cash and carry no ye. Uka, no Cheska.
Okay.
One Cheska and show.
And then maybe I want to hospital. Next can you go to Kumwa?
Yes.
Yes, what we are in Kofi.
Yes.
Oh, okay.
Yes. Now along the line, and Catholic Church, started nipa Cheska, it's a health insurance. And ye be or Kranza.
Be Bono East.
And we be or West Gonja, Damongo. Yeah, and I feel in Coco so we.
Oh, okay.
And ye be a pilot to a share. Nay, Omuankasa, nay, and now by a sorry no one, and Omu yes, but say a sorry no Kwani members, any of these three places. And the whole Ghana, and just a cash and carry on a cost. Juma. And President Kufo. Leading to 2000 elections, and or promises or winning or the health insurance, and I or winning into winning and a passy law in 2003, and the passy law said they be a Agyapong, in particular Agyapong, any informal sector,
okay,
almost so a bebom. Because home insurance there is a human being amount health insurance now. But the informal sector there, obioti baby na onwan kasa ankra juma. Omunyina health insurance a buy no. Afa omo a utia premium a. Osusu be dey obenya health wetimi akwa me ahwo.
Okay.
Premium no omutia no. Minu enye sika kese bia. Okay. The health insurance customer, your friend be say actually determined. Say the actual cost of providing care, not to your premium.
Okay.
So,
okay.
But health insurance is there. VAT, any social security contributions, I cover 95%. So when I say investment, I cry about because. The WHO says so betimi aye health insurance in a year as I say utimi efa kwan bi so na utimi raise sika.
Okay.
So we raise sika no a now the nyina akogu fa in terms of the VAT no any social security contributions no egigia na the nyina akogu ba bi a friend pooling. Yes.
Okay.
It is a pool.
Chakogu adia fuba.
Yeah.
Okay.
It is a grawa na.
Bibisa.
This kind of kogu. And this kind of idea kogu mono. And no na be idea be a friend strategic purchasing. Just a would better services. Any enroll. Ama and prefer health insurance no cover all. And no na health insurance. Yes, say. So. And he say, health insurance I na about 2006 when I maybe join here. Maybe join here near 145 schemes since the President Kufo and he said, young create scheme every district in Ghana.
Yes.
And he may buy it as director of operations, Now, many about one and director for ICT.
Okay.
Ben Kusi. Yes.
Okay.
And Bakosun Andu Ajay, Dr. Andu Ajay. These were key people. Now, Jumama, the CEO then was Rasbwati. on a CEO
Dino Makai Dino.
Yes.
Makai local organizing committee was he part? Makai Ghana Eberbock and 2000. Yes. Yes, he was part. He was part.
And yeah, all over the country, you travel around the country, making sure say schemes, offices.
Okay.
Yeah, a decent.
Yeah, cash scheme na idea.
A national health insurance scheme. This will be a oko a Buaka North, and I also call Buaka South, Chebi, and I also call Mikro, Aguna Asante.
Hey,
scheme in
oh, fine.
Yeah. And also a Sidan Kama.
Okay.
Chebi's health insurance, a Sidan Kama, Bino Mea Waguna.
Okay.
During retire. And you're making sure say, yes, I am now, na any panel schemes not account to Nipa or more a register or more, the Huska come on. And you say, I didn't know, not inquiry because after registration, no so not inquiry, Papa, and near and can register more people than the population of Ghana. And here say, in order to remove all those bottlenecks, any inefficiencies, any unfortunately corruption, any few engaging in that, say, you don't baba beshe fa. Now I one national health insurance scheme. And here, but before say, national health insurance scheme, say one national health insurance scheme.
Yes.
145 schemes, no BR negotiate with another providers, no chair muka. So, na inrua besa pe no masan ye. Nti omu yes na omu an na era na omu they were semi-autonomous. Nti ye say ye national health insurance scheme. Let's say ye near set your prices. Oh, ye near rate setting. Ye near be say doctor we ukono malaria say ne betria. Nti malaria no and they so-called doctor we have public provider for example, local district hospital level, I was secondary takradi, and I say boku, and I say a flower, and I say domain crow.
Yes.
You will try the same thing.
Standardized.
Okay. And yes, I did. And Dr. Service is by Dr. Service is in my quality standards. Dr. Lydia Janiselvi. So hospital biano. As I say, qualify and Sanya more provide services.
Just all qualify, as
qualify so quality standards.
Okay.
And you may be who has a say to me, and you may be who has a say to me. So and Sana health insurance amount. Something a friend is a credential say.
And just sorry, Yana. We say how abused.
Yes, sir.
Oh, okay.
As I say, buy health insurance. Now, making sure say quality standards, With me,
the quality standards and there's an components, but quality standards.
Okay, it is a beer. Any papa or now mobile care. Care now the mom.
Yes.
Will be beer as I would provide care to treat that condition on the Panadia Bahono. And the environment, name P. Okay. So, I just want to me as Animanina. And he, or no, any minion, no me will be Ishmael Osei, any Vivian Adokobia. Omni Dr. Selby. Quality are dealing in a so omna. And he Benkusino Afa, IT, and Nema. And I'm Mrs. Minimi with team operations. Dr. Sensubo is coming home, many answers, Dr. Andrew J. And I also manage operations, I train and Dr. Chinobu Asubai.
Okay.
And I may call a crochet, sick as someone says a year seti rates now. Send is BCI, and any R&D.
Okay.
And Dr. Chinobu before operations. And he may make a son, and I'm a D medicines list.
Medicines list?
Yes, say, listed medicines are under the National Health Insurance Scheme. Obia, Okwa, side row, say, and our area, a bit media amount.
Okay.
Yeah, in conjunction with standard treatment guidelines, of Ministry of Health. So, with your honor, so Ruby Mensa, and Dr. Sansubwedi.
Okay.
And so a boy, you're running R&D, a year. And ye winning in a year. And this lose the elections. She's an prepare to make the national health insurance one. It's all the systems are here to have the National Health Insurance as one entity. And the NDC bar power, President Mills, Mahama Bayen.
Yes.
And I almost pass a law on a friend Act 852. But health insurance, you know, Casa de Munia Meka say, without a doubt, President Kufone de Baye.
Okay,
so share literature all over. Literature be over kind or reference it to say 2003.
Yes.
And the National Health Insurance about Ghana.
Oh, okay.
Yes. That time when the president.
Okay, Wikipedia na say any yidiba.
Yeah, Bibia obey no. They will be who you say 2003 National Health Insurance by.
Oh, fine. Yeah. Then it tells you that National Health Insurance about Boapa.
Yes. About Boas say other researcher many will be publishing number 2 and who number P. Then you know say the average Ghanaian easier for the person to access healthcare.
Easier?
Yes.
Okay.
So Nipani area, Unya baby call. And I make us 70%. Omuntia capre. A binum ID card kakra na otua, but premium one kasa omuntia bi. And kola up to 18 years. Omuntia bi.
Yes.
And 70 years and older.
Yes.
Omusuntia premium.
But they still enjoy.
Yes, they still enjoy. And ti omo mo mfifi no so no ana midi kan premium no omutua no kakra bi.
Oh, okay. Yes. With the issue of the standardizing, and no more time limit be and I say we go to every part of Ghana geographically you come baby and I say yeah pilot and yeah selected baby if we are then you arrive on this figure say we need the year standardizing.
No, it's in fact medicines let's say there was a process.
Okay.
You travel around the country, you collect prices. A WHO mechanism be the pricing medicines. And you use and see a GG in Rono all over the country. I hear medium prices. Now if you arrive and say be a paracetamol tablet back say and health insurance better.
Oh, okay.
So
okay.
And the mechanism be why and then rate setting tariff setting also so. And so say standardized. And so if our consultants no man boy na near nti okohu doctor bi private clinic bi or Bokua. Sika obejo to treat him for treating malaria no. Sa a private clinic ewo aflawo. And I say elubo. And so bejo.
Oh, okay. And just say ebia me Kumase. Na you find some my government hospital. You call me the health insurance, I call me no, and I don't want to differ or a vary.
It should not differ. So a district level public hospital, a drone should be the same.
Okay.
Say a private clinic, be a one kasawo clinic, Oko Lubo, Oko Tamale, Baby Abokubia, the same. Teaching hospitals, Tamale, Kumasi, Accra, now Cape Coast, almost services. In rural services, the same.
Okay.
Design your running health insurance.
Oh, fine. Yes. But what the mechanism bit was there's going to be stiffer punishment because naturally, obia pelupus nipo tools be yet who say we should bring out something about say a punishment. So who say Mr. Acheampong ha 5 cities, Obi so or turn be 10 cities. Now it comes into your office. No more mechanism be put in place.
Yes.
You check up on them.
Dr. Sel Benini team, Ishmael Osei, NFA, Vivian Adokobia.
Yes.
They travel around the country, only almost senior team, to make sure the standards na ye can.
Yes.
And you'll be for coin be so. Na 5 insurance sika, yeah, and this a call. And see, Omuhua, ne or coin be so a fa. It be court.
Okay.
Yeah. And see. Now, one national health insurance scheme. We did a lot of work. And you didn't be booming in for me to be more a dinner. I don't
said do 18.
Yeah, and you were Mammo, Mr.
Fachem. Then a lot of work went into it.
Yes. Yes. But so be including myself.
Yes.
Be your experience, Yeah, maybe say a boamio, me Juma around the world, Nandi. And it has been good to all of us, and then to the country.
Okay.
Yeah.
Osei B. Acheampong, health financing and ME consultant.
M&E consultant.
M&E consultant.
Yeah.
Former director of operations and R&D at the NHIA. Mami Misa say Edia omukwa na omukwa kopema. Say baby we. Do they come for advice?
So Hanum sir.
Yemfa health insurance say be akwa kopemi hiya bi nchire bi. Does the leadership comes to you for maybe
so almost sometimes so me was say me Ghana.
Yes.
And idea was say was spending a lot of time.
Yes.
We are very passionate about. Say froze will be a bay way and it's all kase unye. It's all konakwe.
It's all konakwe.
Yes.
Oh,
that's my training.
Okay.
Yeah.
Okay. Now NHIS from 2009 by Act 852 for you would kakra ho nsam te say.
Okay, Act 852. And you know about standardizing all the payments and the services and the medicines and all those things, you know. Yeah, no. 852, no. And operationalize it, LI, to support how I pay BBR.
You can't LI na
legislative instruments.
Until the mrasem.
And only Act 852.
Okay.
Yes. And on my coin, it in my yen so say say.
And no components ben and no man ben sanitization.
Why necessary board also?
Why necessary board?
And to use a board no representations also.
Yes.
TUC for private providers almost so. And Ghana Health Services also, Ministry of Health also, and so on and so forth. So many groups also. Until law no be a chair. And I feel such types of services are. As I say, health insurance here then a cover.
A provider.
Okay. It's a where the near cover.
Cover.
Say your providers. Yeah, payers.
Okay, cover.
The name of Ben San cover. Until the cover be no. Okwa asisi etuaka.
Okay.
Yeah, and this otuaka pre. Health insurance okwa obia okwa health insurance okwa ne use card. Say a cover service no. Na etua for a drone one.
Yes.
As I say free.
Really?
Yes. So obia use card I saw report no.
That boy. Now if you look at health insurance now, a cover yari bia
Debbie.
Okay.
A cover about 95% of a area afflicting Ghana. A year Ghana has say. So a cover. And you make a crabia, a seven, a mushe air or when you see a same more. Yes, and a bit more there and cover. Because also health insurance, to move the country towards universal health coverage.
Okay.
So, say the way a Nipano do one bed, a bear cover, and they know. Your health insurance registered, could you believe it, 17.5 million.
So almost half Ghanaians.
Yes, of Ghanaians.
Yes.
About 55.5.
Yes.
Are registered under the National Health Insurance Scheme.
From where you sit, and for pressure be a mental health insurance for so. Say Ghana would chim now say a move 50%, not 5% sign count. And for pressure be a mental health insurance.
So can the pressure in terms of utilization?
Yes.
Okay. And to say CEO no about why BB.
Okay.
And say health insurance be preventive. Any promotion. Okay. Very important. As I say, utimima nipa who say utiwa way any so
Yes.
We are between affect all your health. So and now one more so survey non-communicable diseases, which are diabetes, hypertension, in your and be one is OD.
Okay.
Never be one is all yet. Biansan, so slow down, crash. And the current head, CEO,
yes,
or yes, I did. And in I'm a pressure now. A buy health insurance also in terms of utilization, a bit me perform kakra. Because utilization and translating into cost. So what I say, cost and also cost rupee and they affect the sustainability of the scheme.
na fabra from na chere yase it's a cost no do so say
a cost ra so and yeah say nipa yare a omo nko na nhwe but as a so team so emma nipa so hu say yare nya depa it is what you are nyema bi ho ani so ye
lifestyle no
your lifestyle yes. Modifications be as so ye no ni we cigarette no ne ade fifiri wo no msa no 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 kakra na fe aduane bi ho a eni ne pi time obidi die meni dia na jupi ene manema pi enti eno no boa na fe so o hwe utilization me sane man o katapa utilization so analyze now to me who doctors are or claims no outliers
okay
what they compare the mainstream na omo kwa de baby egu baby so hwem na hu adekra omo ya enti ama omo yi no etisa
okay
aha edu utimi yes ani manema we no nyina na fe o manage medicines medicines so ya dey so to be manage so be obenya ye won krofo bi o mo manage medicines utilization unya bi no mo mbeboa wa
okay
ni nyina no ema omutimi ma medicines ohu se asumasi bi a nuro bi o ha eni ade no so kra na mo prescribe but yenyantimi nchie wo mo anase yenyantimi enhu ye anase aduro bi wo listen so but omo apply edititi yare bi a standard treatment guidelines na wo Ghana ha no NHS so omo yesa
oh okay
yeah Ministry of Health din penifo yi atitru atransi ene ya kire say yare we ene ye be hwe ye be treat wo Ghana ha na say obi nya sa yare ni bia enura ne procedures say ye ensusu eni
oh okay oh
yeah
okay
the health insurance adwuma na ye near in line with Sanyama yes
now health insurance kwan amafa so am ahye no every 2003 ba modi mu input ba modi mu adwen kire ba na ba bia eko what dem mu sisi a na o hwe health insurance today what can you say about health insurance
today I think say o my adwuma and then I'm proud to say anyone na ekwe no ya nyangu yene ani from the beginning no na me because be bobo nipa ni bi
yes
myself Benkusi Dr. Selby Vivian Adokobia Ishmael Osei Dr. Sensubuadi Dr. Ando J one more me bo mu din no operation side no operations for no kwa din na
yes
who's a supportive areas we say finance no I made no more finance ni other people good stuff no or more finance almost so boa
okay
senye o mo ke ntimi nye adwuma
okay
so finance for ni procurement for ni o mo bi ntimi nye na adwuma yen ntimi nye
to me tade na say a teamwork
the teamwork nti on say ye we no nyina wie no ya na me can say Prof Mills buy no na Sylvester Mensa na AC
yes
and they pass the law
oh okay Benny health insurance oh what means what TV obi so me call ye kra no yes in no we ni ho yes we ni ho on TV
me TV
how do you feel
me TV me say me tisa na man ya na because na me ka say me o ho no me na me oversee the development of the medicines list and me nim say yare we
yes
adro we cover so
yes
a wonure cover yare so obi di yare no call health insurance hospital accredited and as a credentialed hospital na ya ginisika any se basa
because na so better be say o we kodu okra mo sin duro bi ani ho minim so wonte ya people even claim say health insurance ni kura
o mo boa
but so aya wote
me TV but don't say nipa kasem for all kinds of reasons obi o ha na ebia the health insurance nya metrianica and nya metrianica no ntino na obi aba ho a o se ontuaka meanwhile omuba na oje omusika na health insurance discount brewer onfa obi a oji ni sika nkoma no ba mebo aha and yes stress omo nyesa na health insurance so secretary no so
ahono kwa me ba ho wo hwa what has been a major challenges because wo ho a yes o da bi na say kwa mfa nro ne nko mo de yeka na de health insurance na no adam te so makwa kutu 400 million or something
yes
wo ho a is What are the challenges? Then the coffers are no man at the bar. Carry to Bogufua, that man first take a sans and attention.
Well, so Sikano say VAT.
Okay.
VAT depends on the economy. Nipa buying things, and Omutia, Nipa Tonyama, and Omutia VAT. So, and social security contributions. The economy can also affect the readiness of the scheme to get the money. Unsenamika say raising of funds.
Yes.
Who raise funds na they are kogu baby. Na fe ebase uhia services na odi akutuaka. And sometimes ebi o ha na sika na nyanye ready. Yeah, we were akutua, but then no interest health insurance entry.
Okay.
Time me ho ni nyina ka bi health insurance di bia no omutua. And me free also so the car matters omu die bia no so omutua.
Oh, okay. Oh, okay. All right, so that's show him live on the 2TV. We call this show the Dialogue Show. Your name, Mr. Osei B. Boache, and Acheampong, and Nkumui, Health Financing M&E Consultant, former Director of Operations, R&D, NHIA. In the case of health insurance, wa bingo muye penipa ba health insurance ne hyehyɛ ne kyekye waboa de adoma nyame de adom no ne input nyame de akyɛ no de aboa ma Ghana kɔ n'anim a papa yi untimi nka abra uyi no de afim. Now Ghana ade ba ko amanfo attention wo so yi pa kidney what you say obi anya kidney problem ne sa no ma no. One, health insurance, does it cover it? And as a cover
have insurance and cover for yenina.
Okay.
But then say me no hono na cover.
Okay.
But say name so my share a cover and kwada. Any penny for pa. But don't say nipa na won fin so and a dose pa.
Middle age for no dey near you
yes dose. And I'm say health insurance, health financing ehia me pa no. Ma share MPP manifesto.
Okay.
And I share NDC manifesto.
What are you technocrat? And you know what the nase?
It made me share the OBI and mama who comment.
Okay.
MPP, dear no, almost say chronic, almost be creative be a friend of chronic diseases fund.
Chronic diseases fund. Okay.
Yes. The chronic diseases fund, you know, chronic conditions in the kidney disease.
Okay.
Yeah, and no na, you did dialysis every day.
Yes, sir. Okay.
So
yes.
Diabetes can hypertension can no many other day. Enya mai, but minim say dialysis ebe dimu akutini pa. Ewo sadie no.
Yes.
Enti sese no mutua nkwala de ni mpanimfo de no. Sa fund ne eba. Nhihye pii beba omude be. Ana ma hwe NDC so manifesto no. And this is also dialysis in every region.
Dialysis in every region.
Yeah, services in every provided services in every region.
Okay.
Let's just say almost be hospitals. So region be a teaching hospital.
Oh, yes.
And to the highest in every region, no. Say so teaching hospital, not a regional hospital.
Okay.
Currently, no dialysis there no teaching hospitals. Ghana, Kumasi, Accra. Kolebu.
Yes.
And then I think Tamale teaching hospital and then Cape Coast also teaching hospital.
Out of the 16 regions, you know.
Yes.
Only 4 regions.
Yes. Made say technically Honam says say omo no. Jamie Machia about dialysis. Yes, sir. Dialysis, say this the way is here no chroma and yet readily available. Okay.
As a Chinese say.
And just and yes, all you are obinya. And yeah, affordable. Affordable say you be an bit
So the one was rock crap.
Yes.
Okay.
And sign available maybe be a book times be that way anyway in a brand near the idea. Dialysis because we were US in the 90s. A dear Casio. Nani boy din because not as no hospitals, no teaching hospitals. No.
Okay.
Okay. The insurance companies, no, Emma Mutimi and yes, as I said, we free hospitals. Now they call free standing. A free division free standing. Can be buy a dying CI. And near hospital be but obia ankrankra bia woni sika and wakoto dialysis machines and offer a nipa omuti kidney yare treatment ase and omwa and you provide the service.
Yes.
So me feel say hospital lady I did be a friend acute so being acute kidney problems be say bia wako DBB wako no bibi na say yare bia no na a trigger kidney yare bi no ne ade omo no sa no onipa no da hospital as say omunya service in our hospital but ye freestanding centers now and they are in the communities.
Okay.
Yes. Now the dialysis, which are the cost structure of dialysis, professional service no. Omo ya ade. And a consumables yedi dialysis no. So now the kunu the overhead cost.
Overhead cost.
Yes. This all no hospital kasiye mu sa dialysis center no. Oni diabetes center, oni OBGYN center, oni we omnyina na eche overhead cost. Nti say inefficiency bi o baby a. Dialysis center no so ye den. E bi beka no. Affect no. In their price structure. Yeah, and it's almost cost to omo yi no. Omo so de ne beka so. Omo price ne beka so. So, but what they call freestanding centers there. And on one kasa dan one overhead. And I'm saying, one kasa and omo they will be able to control the overhead better. It will be my dialysis cost so high then. Akufo. Okay. It is a freestanding centers ni na so to consumables in the bulk. So economics kakra. What's the prices no?
Yes.
Yes. So, that is what US did. And companies to be back the Gambro and back the Fresenius.
Okay.
The brand they took over dialysis all over the country. And in America, communities and community be not dialysis center be all. Yes, will be a feel no corruption teaching hospital can say be a cool say or come I dialysis. And to me feel say MPP the enemy who say a PPP. Public-private partnership. And omufa omonisho na omunye freestanding omumankrofo incentives. Okay, and the same as the NDC one. So it's not going to work in terms of with the Google hospitals. Maybe the freestanding center. It should be the future of dialysis service in this country.
Oh, okay.
Yes, because I've seen it work in South Africa, in Qatar, and then the US. So why can't it work in Ghana?
The method and answer operational in other jurisdictions. So multimedia. Yes.
And young hospital then treat acute kidney cases.
Acute.
Just about hospital na bibi na trigger bibi and a hospital setting.
Yes.
Yeah, obesheno ama kidney no ay resuscitated. I atimi na juma na ho ato no kofi. But obi when you kidney disease, the friend end stage renal disease.
End stage.
Yes. Sometimes in the dialysis na
I saw that.
Yes. And I say until so be kidney transplant.
Kidney transplant.
Yes.
Okay.
And then the ultimate transplant there and na.
Hallelujah. Na just say oda kama.
Yeah. And I want to say and but you cannot be talking about kidney. Yare any dialysis without talking about preventive care.
Preventive care.
Yes. And nema ben ya ma kidney yare koso.
Dom na boy. E no masa.
Well, say in Raya no mu.
In Raya no.
Yeah, painkillers. Funny pia anye.
Really?
Yes. Yes. And he said money a habit. So kakra bia no afa painkiller. It's not good for the kidney. And I feel sanom so so good for the kidney. Many clinician, maybe they share the finances.
Yes.
And the man who see treat your account. And I maybe do. But clinicians in the omit me and chill say, we will be a say and be a say. Near ma and my kidney area. So send an issue. And no. herbal medicines not do so do. Then be over here TV so be and I say, which we can send it
Is it a contributing factor?
Some of them. Yeah, some of them. Me and my family member be Anya kidney we.
Okay.
Yeah. Of a side drone be. And as a researcher, I can link what happened.
Yes.
The Nipani year, any DC. And you may any evidence based.
Evidence based.
Yes, I have the evidence.
We can't just a pictorial one.
So if I drew in a no way.
Okay.
And I want more around him, and who said, "You didn't go hospital." I said, affecting the kidney. Then he died. Just say,
Then it means that the government of Ghana should bring out measures.
Yeah.
Especially in this kind of areas, because it's a non-day. Obi adults.
Yes.
Adults. I drove back to me say I 20 and I say any and the cost of so called dialysis no boss what
and so no boarding and the necessary share I'm a nipano could do and Sunday a pisca divitriaka.
Yes.
Why don't you also
prevent it? Yes. Now probably
yeah.
Even the pains you go through.
Yeah. And the papa na de na oye NHI as I say support on the power.
Oh, okay. Now, say, my miss us our question. Say, if you look at primary health care, health insurance now, are you okay with it?
Yes. One health insurance, WHO, and MBA, Yejinaso, at the primary health care. A bini say service reforms, provision reforms, one of them. To say a nipa area, baby as a so mukono, omunya echo. Health insurance are provided sadly. And disparities, reducing disparities in access to healthcare services. And also when he said, nipa bi oha na nka omo yare a no omu baby as a so mukokra, omu ni coverage, omu ni scan omu ade. But health insurance, you say you are moving the country towards universal full coverage. Okay. And health insurance is so aboa. And social enema WHO require for provision of primary health care. But also stakeholder participation.
Stakeholder participation.
Yes, health insurance and NHI in Kwana drive. And no more workers. No. Are you forced to come? Providers come.
Okay.
Oh, and the community members now also come. And the from time and what is saying, your core communities, your kasa, your educate nipa about town hall meetings, about national health insurance, and the stakeholder participation. So, what did they train? And register, say, 55.5% of the population.
Yes.
Or more, 70% capre. Okay, in terms of premiums.
Yes.
One more mutual premiums and also so the mutual and yet actuarially determined. And yes, you can work on be 50 cedis. 50 cedis which me they show for the whole year. No. But VAT in any social security in a bois made me pan. And there is a system that is working. System be no a bit me and the force kakra. It is a society in you near anything, near fix it, near query.
Okay.
Now, I'm because my share was health insurance and nipa pomudin, the finance,
It's very, very important.
Yeah, and my share, manifestos in the the NDC one talks about free primary health care. The minimum, only me, any free primary health care and any health insurance.
Really?
Because I mean how they are going to do it. What did I mention?
Yes.
And there's so many who how they are going to do
it.
Because health insurance, the claims in about 90% primary health care.
Especially the
day.
And no nipana na kwa kutu ane die.
And I say
a Bible take over.
Yes.
And I say
and I who said free primary health care. WHO is preaching against that. So, Omaimbia move towards universal health coverage through health insurance. insurance systems nti yɛn yɛ say private insurance for ka ho ɛna national life insurance ka ho wokɔ kuro no bi wɔ hɔ a ɔmo deɛ te sɛ South Africa say yɛ planning de ɔmo deɛ no na ɛyɛ one obiara private sector obiara de ne sika bɛba ka aban deɛ ɔne de nyinaa kɔgu
fund se pool so na
pool nti ɛnɛ South Africa no ntɔkwa a ɔmo kɔ health insurance ho no bi ne yɛ sɛ aborɔfo no hospitals na ɔmo mpɛ sɛ tuntumfoɔ no bɛba hɔ bi sɛ yɛn nyinaa yɛde sika baako na ɛhwɛ yɛn deɛ a obiara bɛtumi akɔ baabiara
okay
so ɔte ase
okay
nti ɔmo ne ɔmo atwea because the system that existed before apartheid collapsed na aborɔfo no ɔmo deɛ na tuntumfoɔ no
sɛ wɔ mo deɛ
but ɛnɛ no health insurance na ɛba South Africa no obiara bɛtumi akɔ baabiara so nti back to primary health care no a free primary health care na ɛsɛ sɛ yɛte aseɛ pii vis-a-vis national health insurance because ayɛ ho adwuma ama sɛ sɛ ayɛ krabɛhwɛ so nti ayɛ krabɛhwɛ no ɛdeɛn biribi na ɛsan aba yɛnim nti ɛsɛ sɛ NDC for no ma yɛ ho America sɛ elections yi asɛm bi a ɔbɛka biara no
yes
ɛsɛ ɔkyerɛ
they will probe you
they
will ask questions
kɔ first no wɔ hefa na ɔde abɛyɛ
kwan bɛn so na abɛyɛ no
kwan bɛn so na
road map ne te sɛn nhyehyɛ ne te sɛn programs ne te sɛn time limit room ɛne saa no ma no
health insurance wɔ hɔ a ɛyɛ adwuma sisi yɛmmoa yɛnhyɛ mu na nyɛ den yɛnkɔ anim Germany for ayɛ ɔmo de over 100 years health insurance na meka ho
over 100 years
yes ɔmo ayɛ ɔmo de over 100 years ɛdeɛ nti na yɛn Ghana so nkurɔfoɔ abɛhwɛ yɛn abɛsua yɛn no Rwanda no nyinaa ba ha
yes
yɛ a ɔmo yɛ ɔmo health insurance o na sɛ yɛn deɛ na kɔduru mpɛmpɛn so sɛ ya ɛni sɛ yɛtwam.
Okay. All right, so that's what I'm live on the 2TV. We call this show the Dialogue Show. NT best sorry so now afi agenda ababa betwas national agenda ababa betwas so Osei be Acheampong, health financing and M&E consultant, former director of operations and R&D NHIA. From where you sit,
Yes.
you can look into the future. As Obia, you are a technocrat. What's your again say? How do you see the health insurance from where you sit in the future?
I think the health insurance they have made a lot of progress. Okay, from the CEOs or and they time now uko health insurance officer go.
Yeah, lie.
Nowadays register renew
yes.
and then what you fear no for a phone.
Yes, at the comfort of your home.
Yes.
No
renew.
Yes.
Call baby. So, and the thing is working. And I make us say promotion and preventive and then I beg say a woman under this current CEO. And to have insurance going forward on a idea economy a bay and to say a boy. Now this is the can be a young cosia, the akufo-addo, near say bit me apply.
Okay.
So, under the context of yen yaha, I want to make us say countries beauty say Qatar, Brazil, Thailand, Estonia, okay, Colombia, Chile. We both few developing countries, and then South Africa, and then Nigeria.
Yeah, okay.
So, someone a national health insurance, obviously almost casting. I didn't think say NDC may free primary health care. Yeah, years ago, Yantimi and the Kofa cash and carry by.
So what are we trying to go back?
Why are we trying to go back? This thing is working.
Not just going back alone, but if you look at a who's use and so
yes. Yes. The future is unknown. And to me as a health financing person, about me as a Juma many mean Crawford
foundation come my year pejad the NDC
bedroom ribbon and
na SMB dream.
Yeah, and a year Juma view a behind.
Oh, okay.
Ye more pie. Na parties name you Juni, and health insurance. Do you have a way be or my health insurance? And you know.
Oh, you know mine.
Yes.
My
and I make us say, Qatar is a very rich country.
Yes.
South Africa is richer than us.
Baby.
So, what you say, Colombia, no, Chile, no, no, GDP, near the better thing. And say, one as you obey health insurance. Because, you see, you standardize it, service delivery, so any access to services, any quality. This is what health insurance brings. So, what me yes, I never will mean a boy, improve healthcare.
Oh, okay.
Yeah.
Oh, okay. And they say, oh, say, Obi Bow chance or percent. Abia or Beje Wadwin training for health insurance or even outside Ghana. Are your doors open?
Yes. So you know, my retired team, me consultants in a way.
Oh, okay.
Yeah.
Oh, okay. Oh, okay. And even if we come into our inner circles of a political balance, you cannot say Abia political party means that let me go to Obi. Abia health insurance and church I want to seek for his input. Yeah. Your doors are open.
Yes, maybe so as a DNT now person way.
First question, the DNT now person
way.
Okay.
No, I church him. Now, so my ginger say, if you are dear with you, we are more.
Okay.
And you say, also because of dialysis.
Yes.
In my view, and yen free hospital setting, then go freestanding.
Okay.
Then you private public partnership, a buying grammar. Partnership, and now I say I buy my incentives for private people to be able to do that. So be a machines in our crab. Let's say taxes here waive amount. Yes, because Nina will get into pricing.
Yes, and they will pass it on to the consumer.
Yes. Yes.
Because I know Obi ko you know man at the bar.
Yeah.
Now everyone is out there and Bianca tax needs to be 10,000 cedis. He will pass it to the consumer.
Yes.
But it's 20,000. Still, he will pass it to the consumer.
I buy anxious animal. And it's a partnership on us. I buy between and you will say, okay, would you the MMA say fat taxes?
Yes.
But also could provide the services. A bit more money would
a bona bafom. Now I affordable. Everybody can access it.
Yes. Will be able to access it and it's affordable to the people.
Oh, okay.
And say freestanding centers and also those one, the services become available to the people. So accessible, available, and then affordability.
Okay.
Zani Manimians are very key in healthcare.
I can't 1 minute in here, sorry. From where you sit, the next 10, 20 years, how do you want to see the health insurance?
Yeah, I would like somebody to sit in Kenya somewhere and say, Ghana, the 30 years. It's only 20 years.
Yes.
So I didn't think I had the 80 million. In America. Because Ghana did 30 years.
Yes.
It's working.
It's working.
I didn't think I had 80 million. So they make us a Germany for the over 100 years. So
it's working efficiently.
It's working.
All right.
As I say,
all right. I have NLT TV called a show, the dialogue show. Me at the Franco, who's what me papa, my